Analgesic. Today's topic for the video is the analgesic. An analgesic drug is also called simply in analgesic or pain reliever or painkiller. The analgesic drugs used to achieve relief from pain, that is analgesia or pain management. Analgesics are conceptually distinct from anesthetics, which temporarily reduce instant eliminate sensation. Although analgesia and anesthesia are neurophysiological overlapping, and thus various drugs have both analgesic and anesthetic effect. Uh, analgesic uh, Analgesic choice is also determined by the type of pain. For neuropathic pain, traditional analgesics are less effective, and there is often benefit from classes of drugs that are not normally considered analgesics, such as tricyclic, antidepressant, and anticoagulant. Various analgesics, such as many NSAIDs, are available over the counter in most countries, whereas various other are prescription drugs, owing to the substantial risk and high chances of overdose, misuse, and addiction in the absence of medical supervision. Analgesics are typically classified based on their mechanism of action. First is paracetamol, which is also called as acetophenone. Paracetamol is also known as acetophenone or APAP. Is medication used to treat pain and fever. It is typically used for mild and moderate pain. In combination with opioid pain medication, paracetamol is now used for more severe pain such as cancer pain and after surgery. It is typically used either by mouth or rectally, but is also available intravenously. Effects last between 2 and 4 hours. Paracetamol is classified as a mild analgesic. Paracetamol is generally safe at recommended dose. Next is NSAID, non-steroidal anti-inflammatory drug, usually abbreviated to NSAID, are the drug which classified that groups together drugs that decreases pain and lower fever, and in higher dosage decreases inflammation. The most prominent members of this group of drugs, aspirin, ibuprofen, and naproxen, are all available over the counter in most of the countries. And next is COX2 inhibitors. These drugs have been derived from NSAID. The cyclooxygenase enzyme inhibited by NSAID was discovered to have at least two different versions, COX1 and COX2. Research suggested most of the adverse effect of NSAID to be mediated by blocking the COX1 conjunctive enzyme, with the analgesic effect being mediated by the COX2 enzyme. Thus, the COX enzyme, which traditional NSAID block both versions in general. These drugs such as rofeximine, ciloxibine, and etofoxib are equally effective analgesics when compared with NSAID, but cause less gastrointestinal hemorrhage in particular. After widespread adoption of the COX2 inhibitors, it was discovered that most of the drugs in the class increase the risk of cardiovascular event by 40% of average. This led with the withdrawal rofeprexin and valdaxib are warning on the others. Etoxib seems relatively safe with the risk of thrombotic event. Next is opioids, morphine, the archifactal opioid, and other opioids. Example: codeine, oxycodone, hydrocodone. All exert in similar influence on the cerebral opioid receptor system. Uh, buprenorphine is a partial agonist in the mu opioid receptor, and tramadol is a serotonin neuropilin reuptake inhibitor with a weak opioid receptor agonist property. Tramadol is structurally closer to Then the codeine delivers analgesia by not only delivering opioid-like effect but also by acting as a weak but fast-acting serotonin-releasing agent. Dosing of all opioids may be limited by opioid toxicity and seizures, but opioid tolerant individuals usually have higher dose ceiling than patients without tolerance. Opioids, while very effective analgesic, may have some unpleasant side effects. Patients starting morphine may uh, ex- experience nausea and vomiting, generally relieved by a short course of antiemetics such as phenergan. When used appropriately, opioids and other central analgesics are safe and effective. However, risks such as addiction and the bodies becoming used to drug can occur. The effect of tolerance means that frequent use of the drug may result in its diminished effect. When safe to do so, the dosage may need to be increased to maintain effectiveness against tolerance, which may be particular concern. Regarding patients with chronic pain and required an analgesic over long periods, opioid tolerance should not be confused with the opioid-induced hyperglycemia. The symptoms of these two conditions can appear very similar to, but the mechanism of action is different. Opioid-induced hyperglycemia is when exposure to opioid increases the sensation of pain, hyperglycemia, and can even make non-painful stimuli painful. Next is alcohol. Alcohol has biological, mental, and social effects which influence the consequence of using alcohol for pain. Moderate use of alcohol can lessen certain types of pain in certain circumstances. The majority of its analgesic effects come from antagonizing NMDA receptors, similarly to ketamine, thus decreasing the activity of the primary excitatory signal boosting. Neurotransmitter glutamate is also functions as analgesic to a lesser degree by increasing the activity of the primary inhibitor. Attempting to use alcohol to treat pain has also been observed to lead to negative outcomes, including excessive drinking and of alcohol use disorder. Next is cannabis. Medical cannabis or medical marijuana refers to cannabis. It is used to treat disease or improve symptoms. There is evidence suggesting that cannabis can be used to treat chronic pain and muscle spasms, with some trials indicating improved relief of neuropathic pain over opioids. Combination. Analgesics are frequently used in combinations such as paracetamol and codeine preparation found in many non-prescription pain relief. They can also be found in combination with vasoconstricted drugs such as pseudoephedrine for sinus-related preparation or with antihistamine drugs for people with allergies. While the use of paracetamol, aspirin, ibuprofen, and other NSAID concurrently with weak to mid-range opiates. Several combinations of analgesic products have been shown to have few efficacy benefits when compared to similar doses of their individual components. Moreover, these combination analgesics can often result in significant adverse events, including accidental overdose, most often due to confusion that arises from the multiple components of these combinations. Other drugs, nifopam, a monoamine reuptake inhibitor and calcium and sodium channel modulator, is also approved for the treatment of moderate to severe pain in some countries. Adjuvant, certain drugs that have been introduced for uses other than analgesic are also used in pain management. Both first generation and newer antidepressants are used algicide as NSAID and opioids for pain involving nerve damage and similar problems. Other agents directly potentiate the effect of analgesics, such as using hydroxyzine, promethazine, and carisoprodol or triethylene to increase the pain-killing ability of a given dose of opioid analgesic. Dextromethorphan has been noted to slow the development of the reverse tolerance of opioids as well as exert additional analgesia by acting upon a NMDA receptor as dose ketamine. Some analgesics such as methadone and ketamine have intrinsic NMDA action. Topical anesthesia is generally recommended to avoid systemic side effect. Painful joints, for example, may be treated with the ibuprofen or diclofenac containing gel. Thank you.